Dr. Baveneet Kaur Dang, MD Medicine. I am an associate professor in PIMS and a consultant medical specialist at Dang Hospital. So today we will be encountering a very important topic, that is antimicrobial resistance. Okay, so globally this has become a very big problem for the medical practitioners and the doctors, because there are various reasons why we are encountering antimicrobial resistance. First of all, what do you mean by antimicrobial resistance? This is that the antibiotics are not working appropriately for a given organism. So the major reasons what we are seeing in our clinical practice, why this is happening so much, is most important is the irrational use of antibiotics. Okay, suppose there is a patient in the community, he has a viral infection, a simple viral infection like sneezing and sore throat. So without analyzing the patient that the patient requires an antibiotic, there is an irrational use of antibiotics in the community. And one of the most common reasons is the over-the-counter use of antibiotics. They go to a chemist and they take an antibiotic without considering that we are increasing the prevalence of antimicrobial resistance. Now in the community, we also have a term known as super antigens. Okay, so this is also a term that is now coming up because most of the antibiotics are resistant to various microorganisms. So what is the reason? We usually have a step ladder approach to use of antibiotics. First we use first line antibiotics, then we increase the potency of the drug, a second line antibiotic or a third line antibiotic. But now what we have seen, especially in the hospitals and in the villages also, they are directly going on to broad spectrum antibiotics. So this is a major reason why we are encountering this problem. The second problem is the wrong dosage and the wrong timing of antibiotics. Now each antibiotic has to be given in an appropriate dose at an appropriate time interval. And when we are not following that, then this is going to increase the prevalence of antibiotic resistance in the community. So it is very important to practice proper dosage and proper time interval. And for this we have to educate our nursing staff, our medical students and doctors in general. Now, what is the most common problem that we have with an antibiotic resistance is that we have to keep on increasing the dose, or we have to keep on shifting the antibiotic very frequently if we are having an antimicrobial resistance. So this is going to add to the burden of the patient. One, that the patient is going to suffer more, the agony is going to be more. Also, the cost effectiveness of the therapy also goes up. Okay, so when we are changing antibiotics frequently, okay, and all these higher antibiotics, broad spectrum antibiotics, they come at a very high cost. So we are increasing the cost burden in the patient. Now, what are the various ways in which we can prevent this? So most important is we have to stop irrational use of higher antibiotics. Okay, so we should have a step-up approach. If you can do with a simple antimicrobial, then we must consider that as our first option, and we should hold or we should preserve the broad spectrum antibiotics that are available with us, because we have a very limited array of antibiotics that are available to us. So one, we have to talk to the patient, we have to make them understand that we have to first give a proper dosage and time interval. We will wait for some time and then only step up an antibiotic. Next, we also have to talk about various prevention techniques that the patient can have or the staff can have. One is when you are dealing in the ICU, you have many patients, so the staff should take proper precaution of sanitizing their hands or washing their hands, and only then going to the next patient. So this prevents the interpatient or a hospital-acquired infection in the patient. So that is one of the major problems that we are dealing with these days. Then, we can use a mask and we can do proper hand washing, hand sanitizing, so as to prevent any infections in the community. So this antimicrobial resistance is becoming a major global burden for us. And if we are not careful, then there might be a time where we do not have a lot of choices of antimicrobials available to us. So we should have a very judicious use of the antibiotics. And one more thing is that we should always wait for a culture report. Suppose you are having a sick patient, and if you are doing a urine culture and a blood culture, seeing the antibiotic sensitivity and then prescribing a drug, then you are definitely safeguarding the various antibiotics. You are not giving over usage of antibiotics, okay, like we give an empirical therapy initially. So we should avoid giving too many antibiotics to the patient, and we should wait for a culture report with a sensitivity profile and then give an appropriate antibiotic. Thank you very much.